Hi, I'm Dr. Anju Birmani. My colleagues and I are here to discuss a very important topic today. We all know that half the waking hours of a child are spent in school, and that school teachers play an important role in forming and guiding children's personalities. The child with type 1 diabetes must manage diabetes in school as well as at home. And today we're here to discuss how a school teacher can help the child make the most out of the schooling hours and become the best person he or she can be. This educational material is modified from the East Bay School resource and prepared by a team of eminent pediatric endocrinologists, including Dr. Sirisha, Dr. Preeti, and Dr. Divya Lakshmi. And what will we be discussing in the module today? We'll be talking about what is diabetes and what are the main types of diabetes, how is it identified and treated. Most important, what is the teacher's role in facilitating the safety and the well-being of a child with diabetes? What are low blood sugars? What are high blood sugars? How to recognize them and how to respond to them? What are the recommendations for diet and for activities and sports? And how to manage special situations like day and overnight camps, exams, etc. When we end up with a list of do's and don'ts. Thank you.
What is diabetes? What are the main types of diabetes? So diabetes is a state of inability to regulate one's own glucose levels or sugar levels in the blood. This can happen either because there is a decreased production of insulin or there is a decreased action of insulin. So either the insulin is not sufficient in the body or there is enough insulin, but it is not working properly. So what is insulin? So insulin is a hormone. A hormone is a chemical messenger passing on signals from one part of the body to another. And this particular insulin is produced by a gland known as pancreas. So the beta cells in the pancreas gland produce insulin. And insulin is essential for life, and we are going to see how. So what is the relationship between glucose and insulin? It's important to understand that we all need glucose. Glucose is our energy source, just like petrol or gas for a car. Whatever food we eat is broken down by our digestive system to glucose, and this glucose enters the blood. But how does this glucose from the blood enter the cell? How do cells get the glucose fuel? See, when you remember, the cell is a building block of all our body's organs, and all cells are like closed units, imagine like bubbles. For any substance to enter any cell, they need to pass through a particular specific door. So on the cell, for glucose to enter the cell from the blood, it needs to pass through a glucose door. So what does insulin do? Insulin opens the glucose stores on the cells so that the glucose in the blood enters the cells to give us energy. So insulin works like key to the glucose store so that the glucose in the blood enters the cells and makes the cells happy. What if there is no insulin? Or what if there is insulin but it is not working properly? Then the glucose cannot enter the cells because the doors are locked. There is no key to open the door. So the cells do not get energy. So there is a lot of glucose in the blood, but it's not entering the cells. What happens is the blood glucose levels rise, but the cells go down without energy. So this particular state, as to reiterate, can be caused by inadequate insulin production or inadequate insulin action. So there are two major types of diabetes, type 1 and type 2. So type 1 diabetes is caused by decreased insulin production. So what happens is in type 1 diabetes, body's own immune system attacks and destroys the beta cells of the pancreas. So the amount of insulin produced becomes less and less and less and almost zero over time. So this is an autoimmune condition. So type 1 diabetes is not a lifestyle disease and is completely different from type 2 diabetes. What is type 2 diabetes? So type 2 diabetes is where the insulin is produced enough, but it is not working properly. This is a state of insulin resistance. Yes, lifestyle factors like excess weight gain, lack of physical activity, lack of sleep, too much stress, they all increase the risk of type 2 diabetes. And yes, there is a strong genetic risk in type 2 diabetes. It usually runs in families. Initially, it is treated with lifestyle modification and oral medication like tablets, but eventually they also might need insulin. Let us bust some common myths about type 1 diabetes. So, type 1 diabetes is not caused by eating too many sweets. It is not caused by something the parents or the children have done or have not done. It is much less hereditary. It doesn't run so commonly in the families as does type 2 diabetes, and it does not spread by contact. But you may ask, I have seen diabetes happening only in adults. I never heard of children getting affected by it. Of course, it does happen in children too, much, much more than one would expect. In most of these children, when diabetes happens, it's usually type 1 diabetes. So, just to remember what type 1 diabetes is, there is decreased insulin production because of autoimmune destruction of the beta cells of the pancreas gland.
So here we'll be talking about the burden of diabetes, which means uh, how common is type 1 diabetes prevalent in our society globally and locally. And to look at this, we got some data from the type 1 diabetes index, which was published in 2021, which showed number of type 1 diabetes around the world was estimated to be around 84 lakh individuals, out of which, if you look at the data in India in 2022, it was estimated around 8.6 lakhs of people living with type 1 diabetes, out of which less than 19 years contributed to 2.8 lakh individuals. But when we look at 2050 prediction, so people living with type 1 diabetes will be around 17 lakhs, out of which less than 19 years will be around 4 lakh individuals. So once we know the how prevalent it is, it's important to also aware of absolute minimal level of type 1 diabetes care at school in all countries, and there are a few principles to follow this. And this was published by ISPAT position statement on type 1 diabetes at school. So firstly, the principle is to uphold the students' right to safely attend the school. Secondly, to enable the student to experience equal opportunity, obtain equal education, and participate equal in all activities along with the peers, and to allow the student to monitor and treat blood glucose levels at school in a respectful manner and in an appropriate place, which was the last principle.
What are the symptoms of diabetes and how is it treated? Diabetes symptoms. One feels thirsty all the time. Uh, one needs to go to the toilet very frequently. There is an unintentional weight loss. And the person gets tired very easily. So, now what is the treatment for type 1 diabetes? How do children and young people manage their type 1 diabetes? Type 1 diabetes has no cure for now, but research is underway to find one. It can be well controlled by giving insulin, and the child leads near normal life, which is no different from other kids. Children with type 1 diabetes need to inject insulin multiple times a day, lifelong. And they may use one of the following ways: insulin syringes, insulin pens, or through an insulin pump. They also need to check their blood glucose level multiple times a day with one of these: either a finger prick glucose check with a glucometer, or a special reader or mobile app reads glucose from a sensor attached to the arm or thigh.
The second is about the teacher's role in ensuring the safety and welfare of the child with diabetes and providing equal opportunities. Teachers play a great role in future of all children including children with type 1 diabetes. Lots of questions arise in the mind of teachers. How does the child have to check blood glucose level and inject at school as well? Yes, the child needs to check blood glucose. When and how much, it depends upon the diabetes management plan given by the doctor, and it depends upon various factors, including their height, weight, their activity. And in spite of best efforts, levels can still fluctuate, leading to high and low blood glucose levels. Both high or low blood glucose can affect the ability to focus, learn, and play. And as kids spend 50% of their waking hours at school, it is very important to maintain good blood glucose levels at school too. And it is also essential because they affect their activities, their involvement, and their studies too. So please allow the child to carry their diabetes supply to school, which includes insulin pens, syringes, pumps, and it would differ for children from children to children depending upon their diabetes management plan, their glucometer, CGM reader, low glucose treatment kit, extra snacks, etc. Please support the child when they check and inject, and please allow parents to check and inject at school. Before each major meal, the child needs to check blood glucose and inject insulin accordingly. Blood glucose checks are also needed before and after sports, exercise, and sports and exercise also includes dance and other such activities during exams or any time if the child feels unwell in any way. But what about tablets? Your mind may say that my aunt has diabetes and manages it well. Why can't these children have tablets? It is very important to understand that type 1 diabetes is different from type 2 diabetes. So it is better not to confuse type 1 and type 2 diabetes. Who will check blood glucose and inject insulin at school? The question is very important. But most children, above 6 to 8 years, can check their blood glucose and take insulin on their own with supervision. As a teacher or as a school, please provide them a safe space to perform these diabetes self-management care activities. But most of these activities can happen in the own classroom, and it is the best option because it gives the confidence to the child, and it also promotes inclusiveness. Otherwise, empty classroom, medical room, staff room can be used. Treat them just as same as any other child, but with a few important things to remember. It is very important to decide who will check blood glucose and inject insulin at school for younger children. Most often, the parents can teach the school nurse, or even class teachers or teachers can do this. In some case, parents might be able to come to school daily at lunchtime and inject, but this disrupts the school routine. Make sure the diabetes management plan clearly designates the person who will check blood glucose level and inject insulin at school, and if needed, who will inform the parents. You can find the diabetes management plan leaflet at ISPE website. This information should be filled properly. It should have students' name, date of birth, the types of diabetes, because sometimes children do have type 2 diabetes also. It also, like, the things that who will check the blood glucose level, where is the glucometer kept, when to check blood glucose, is insulin required, where the insulin is kept, when to give insulin, how many units, all these needs to be noted. It is very important to know about low blood glucose levels and how to treat. It is important if the child's blood glucose level is less than 70, it has to be treated at the place where the child is, whether the child is in classroom or in the playground. It is also important to know that a child with hypoglycemia can't be sent alone to the sick room. And severe hypoglycemia needs your attention because it can cause unconsciousness, seizures, unable to swallow. So, if the blood glucose levels are low, do not delay treatment if glucose is not available. It is very important to even inform the doctor and the child, take the child to immediately to the hospital. And if the glucose levels are above 300 milligram per deciliter and the child is having nausea, vomiting, abdominal pain, call parents immediately. Also allow the child to take, like, if the child is not having such severe symptoms, allow the child to have water, buttermilk, allow frequent bathroom visits, and still inform the parents because ketones needs to be checked. In the same way, if before any activity the blood glucose levels are less than 55, there should be no activity. The child needs to be given 1, 2, or 3 teaspoons of glucose depending upon the child's age. Treatment plan, which you would be told later. The child needs to be waited for 15 minutes. The glucose check needs to be repeated. Again, sugar needs to be given, and again, the child needs to wait for 15 minutes. And once the blood glucose levels are normal, the child can be given a snack. If the blood glucose levels are between 55 to 80, no activity, again, glucose or sugar spoons need to be given depending upon the child's diabetes management plan. Once the blood glucose levels are above 80, the child needs to be given a snack, and then the child can proceed with activity. If blood glucose levels are more than 250 to 300, the child should be discouraged to perform any activity, should be allowed drinking plenty of water. Parents needs to be informed because at this time, ketones may needs to be checked. Your support can make the child do wonders. Sirisha, mother of S, age 9, Hyderabad, says, my daughter checks her blood glucose inside the classroom during class. We thank her school for treating it as a normal task. Ramanna, father of R, age 14, Hyderabad, says that my son takes insulin shots 4 to 5 times a day, including at school. We are grateful to his school for giving him freedom and privacy. Diabetes should not limit the child from participating in anything.
Dear teachers, today in this section we will learn how to identify and manage low blood glucose levels. We should understand that at all times in the day, a child's blood glucose level should be within the normal range, that is between 70 to 180 milligram per deciliter, shown in green color. A blood glucose level which drops down to less than 70 milligram per deciliter is called as a low blood glucose level, while any level which is beyond 180 milligram per deciliter is considered as a high blood glucose level. Always remember that extreme fluctuations in blood glucose levels could be harmful to the child, so we have to be aware and prepared at all times. Now, what are the factors that result in a low or a high blood glucose level? For a good glycemic control, the insulin levels in the body should always match with the carbohydrate intake. Now, in situations where the child has an excessive exercise or has a physical activity which is unplanned, or if the child takes the dose of insulin without consuming a meal, the child can go into a state of low blood glucose levels. While if a child misses the dose of insulin completely or consumes food which is disproportionately higher in amount as compared to the dose of insulin taken, or if the child is unwell, ill, not keeping good, or is in a situation of extreme stress because of exams or competitions, the child can have a high blood glucose level. Now we understand that a blood glucose which is less than 70 is called as a low blood glucose level, And these are the conditions which are extremely dangerous if not identified and treated in time. Sometimes, when a child has a low blood glucose level, the child can experience symptoms such as drowsiness, even convulsions, fits, and coma. And these are the situations of severe low blood glucose level, which are life-threatening and requires external assistance for management. Now, how do we identify a child is having a low blood glucose level? For this, remember that if the child is very tired, is having headache, or feeling very hungry, or is having extreme dizziness, confusion, or is upset or nervous, or even a non-specific irritability could be a sign of low blood glucose level. Whenever you are suspecting a low blood glucose level, remember that it has to be treated promptly. And for this, always check and confirm the blood glucose using a glucometer. If the blood glucose is less than 70, the child should be treated immediately using 1 serving of fast-acting sugars. Recheck the blood glucose after 15 minutes. If the blood glucose continues to be less than 70 to 80 despite taking a serving of fast-acting sugar, remember to take another serving of fast-acting sugar after 15 minutes. If it is now the blood glucose rises up till 70 to 80 or beyond, this should be complemented a small snack. Now, how do we treat a state of low blood glucose level? So we discussed that the child should receive fast-acting sugars. It could be either in the form of table sugar or glucose powder, or the glucose bolts or tablets, or even the readily available food juices can help in improving the blood glucose profile. Now, the amount of fast-acting sugar the child should take depends upon the age of the child. If the child is less than 5 years, the child should consume at least 5 grams, which is equivalent to 1 teaspoon of table sugar or 3 tablets of glucose bolts. A child between 5 to 10 years should take 10 grams of table sugar, which is equivalent to 1.5 teaspoon or 5 tablets of glucose bolts. And if the child is more than 10 years, he should consume 15 grams or 2 teaspoon of table sugar or 6 to 7 tablets of glucose bolts to maintain the blood glucose level beyond 70 to 80 milligram per deciliter. We should always remember that food items which contain excessive fat in it, like biscuits, chocolates, ice creams, are never recommended to treat a low blood glucose level. These are not the fast-acting sugars. They do not increase the blood glucose level promptly. In fact, they lead to a delayed rise in the blood glucose level, which can be counterproductive. Now, we don't expect our dear teachers to remember each and every detail. So teachers should have access to an individual diabetes management plan, which should contain all this information, that is the type of fast-acting sugars required to treat low blood glucose level, the amount needed for a particular child, and where exactly they can find it in the child's type 1 diabetes kit. Now, after correcting a low blood glucose level, this situation should always be complemented by taking a snack. Why? So as to maintain the blood glucose levels within range. Now, the fast-acting snacks should have at least 15 grams of carbohydrate, and food items like unsweetened milk 200 ml, half of a big banana or 1 small banana, 1 medium apple, a handful of peanuts, a piece of bread with butter or chutney. Any of the following items can be used to complement a situation of low blood glucose level. Always remember that these snacks are different from the fast-acting sugars that we used immediately for treating a low blood glucose level. So always remember some important golden rules while the child experiences a low blood glucose level. So remember to treat the child in place. So when a child has a low blood glucose level, please do not allow the child to leave the classroom. Check the blood glucose level, confirm the levels, and treat it immediately in the classroom as far as possible. Do not send the child in this situation to a medical room or staff room to check and treat. Someone should always accompany the child until the child gets better. In fact, we encourage schools to have a type 1D buddy system where a child's close friend or an associate can act as a buddy and always help in getting out of these situations, especially the emergency situations. Always remember that in situations where you do not have a glucometer to check the blood glucose level, however, you suspect the child to have low blood glucose level, treat it. Okay, so this is an emergency situation. You don't really need to always confirm it. Treat it if you suspect that the child is having symptoms suggestive of low blood glucose level. And do not forget to inform and call the parents about this situation. Now, there could be certain instances where the child can have low blood glucose level and can go into a state of drowsiness or experience a convulsion or get a fainting episode. So, in such situations, please do not panic. Put the child in a recovery position, which is the left lateral position as shown in the figure. Call the ambulance and take the child immediately to the hospital and inform the doctor about the child's type 1D condition. Call the parents immediately and remember not to feed forcefully any feed of fluids or liquids during such situation. Now, prevention is better than cure, so always remember to anticipate situations where the child can go into a low blood glucose state. So, what all we can do to prevent such situations for arising in certain situations? So, ensure that the child eats on time without delay. Give the child enough time to finish the meal. Always supervise the child during the insulin injection states to avoid overdosing. During states of exercise or unplanned physical activity, allow the child to check the blood glucose and eat a snack before and after the exercise. In situations where the child is unwell, always inform the parents. Continue to hydrate the child well and keep checking the blood glucose.
So here we'll be looking how to identify and manage high blood glucose levels. So how do you define high blood glucose levels? So for all practical purposes, any blood glucose levels above 250 milligram per dl are defined as high blood glucose levels. There are certain situations which are commonly experienced in our day-to-day work. Some of them are listed here. So if somebody is skipping insulin injections before meals repeatedly can lead to high blood glucose levels. And different kinds of stress like physical, emotional, psychological stress, for example, exam stress can also lead to high blood glucose levels. And when the child experiences illnesses like febrile illness, it could be viral infection, bacterial infection, sore throat, urinary tract infection, etc., can lead to high blood glucose levels. So why is it important to understand this? Because persistently high blood glucose levels, if not treated, can lead to increased keto acid levels in the blood, which can become a medical emergency. So when do you suspect a person has got high blood glucose levels? So when you see a child where come across needing to visit toilet very frequently to pass urine more than the usual, the child is feeling thirsty more than the usual, or if a child is showing signs of sleepy, lack of energy and fatigue. So all this can indicate uh, possibility of high blood glucose levels. So there are certain danger signs which needs to be remembered, because this will means the child has got ketoacidosis, which is a severe ketoacidosis, which means a medical emergency and action needs to be taken immediately. For example, a child having intolerable stomach pain or recurrent episodes of vomiting, or childish being restless, irritable, and fast breathing. So all this can indicate medical emergency, and it's important for the school staff or the teachers to recognize this condition and inform the parents as soon as possible and check the blood glucose levels to establish the sugars are high. And in case if parents are living quite far from the school and if there's going to be a delay in parents reaching the school, it's advisable for the school to take the child to the nearby hospitals and inform the doctors about the type 1 diabetes so that appropriate management can be initiated sooner. So yeah, I got a testimonial from a parent, Priya, whose child is about 8 years old. So they're just showing how you can manage child's diabetes quite well at school, being being a team work between the nurses and the parent. So through the WhatsApp group, the nurses check the blood sugars every day before the meal and shares the report to the parent in the WhatsApp group, and the parents advise the dose accordingly. And this works very well, and so they have been able to give the best care to the child at the school.
What are the physical activity and dietary recommendations? For physical fitness and mental well being, all children, type 1 or not, should engage in a minimum 60 minutes of moderate to vigorous intensity physical activity daily. Students with type 1 diabetes should participate fully in physical education classes and team or individual sports. Now, sometimes playing sports can result in low blood glucose levels. Now, how do we prevent low blood glucose during sports or play? Parents can make changes to the diabetes management plan for planned activity. Teachers, you can give a sports schedule and inform the parents ahead of time. Please allow extra time to check the glucose and eat a snack before exercise. Now, what if the physical activity was unplanned? Encourage and let the child check the blood glucose before and after the activity. Allow time to eat an extra snack before starting the activity, especially if the blood glucose level is less than 100 milligram per dl. Usually, a small snack, which is a 15-gram carb snack, is needed for every 1 hour of activity. Now, when do we avoid or delay sports or exercise? If the blood glucose level is low, the child can participate in an activity after treating the low. If the blood glucose level is high, or if there is illness, the child can participate in an activity after treating the high as per the diabetes management plan, or when the blood glucose levels fall below 250 to 300 milligram per dl. In both cases, keep checking the blood glucose level every hour during activity. Now, do we have a special diabetic diet? The good news is that there is no diabetic diet and there is only a healthy diet which everyone should follow. Every child, whether it's type 1 diabetes or not, should consume a healthy diet rich in whole grains, vegetables, fruits, proteins, and good healthy fats. Any child, including the one with type 1 diabetes, can have a treat sweets, cakes, ice creams, but remember, it should be occasionally and in limited portions. Moderation is key. Only difference is children with type 1 diabetes should take insulin before a carbohydrate meal.
Hi, Dr. Anjali Mani again. And let's move on to special situations like outings and overnight trips and exams, what the teacher can do in these situations, and the brief list of do's and don'ts I promised you in the beginning. So, is it safe for a child with diabetes to go on a picnic or a day trip or even an overnight trip? Yes, absolutely, with a bit of planning. And what planning is required? Inform the parents of the proposed program. Sit with them to make a detailed diabetes management plan for the trip, which clearly designates who will be in charge of supplies, who will be checking blood sugar and injecting the younger child, or supervising the checking of blood sugar and injecting by the older child, who will be informing the parents in general on a daily basis or in a crisis. It would be useful to identify a hospital near the place you're going to in case of an emergency. And because children can engage in full day activities very actively, expect lots of low glucose events, so keep a lot of snacks ready. Rachit's mother Pragya says, my 10-year-old son checks his glucose and injects insulin himself at school. We're very grateful to his school for treating T1D as normal and taking him on a 5-day trip with regular blood glucose updates. The other situation which can add extra stress of diabetes management is exams. Now, low and high blood glucose levels can affect the child's concentration. So it's important to maintain blood glucose levels during preparation as well as during exams and know how to handle situations if they arise. In 2017, CBSE allowed children with diabetes to carry sources of sugar and snacks into the exam hall to treat any low glucose events. But then technology has taken a large part in diabetes. So in 2023, NCPCR issued a directive to all educational boards asking them to place protocols facilitating daily diabetes care in the classroom as well as during exams. And to allow technology for treating diabetes, including CGMS and the insulin pump or even the humble glucometer, into the classroom and into the exam hall. As a teacher, what can you do? Allow the student to bring the diabetes kit and snacks into the exam hall, make it as normal as possible without drawing too much attention. and providing privacy for checking and injecting as necessary, allow supervised extra bathroom breaks if needed, and for formal exams like board exams, together with the parents, communicate with the examination officer well beforehand. Coming now to providing a safe, fun, and inclusive learning space in school, what can the teachers do? They should insist on individual diabetes management plans with emergency contact details, which are prepared by the parents, the child, and the teacher. They should allow extra time to check blood glucose and eat snacks when needed. You should know what the danger signs are, how to identify them promptly, and how to manage them. And when things are getting out of hand, to be able to inform the parents and to reach the nearby hospital emergency. Don't restrict the child from checking blood glucose or eating an extra snack. Don't restrict bathroom breaks if they're needed and taking rest when needed. But when the child is unwell, don't leave the child alone. Make sure that you or someone else is with the child till he or she is better. Of course, don't restrict the child's activities and sports and exclude from trips as we've just discussed. It's very useful to have an emergency kit in the classroom during exams and in other situations. And this consists of a glucometer, some treatment kit for low glucose, including sugar and snacks, insulin, blood glucose, and ketone strips. And very importantly, the parents' contact numbers and the number of a hospital emergency nearby and ambulance contact details.
Hi everyone, I am Lakshmi Narayana Varimadu from Hyderabad. Yes, psychosocial well-being. Generally, young people with diabetes experience a lot of discrimination, stigma, and bullying from the fellow people, children in the schools and other education institutions. This can affect their self-esteem, motivation, and their emotional well-being. By addressing peer issues and by bringing acceptance to this condition, type 1 diabetes, we can play a great role in we can play a great role in their emotional well-being. For example, Priya has 8 years old Adiva. She is person with type 1 diabetes. They are from Gurugram. When Priya's daughter experienced teasing in her school because of diabetes, the school teachers sensitized entire school on type 1 diabetes. So they stopped troubling Adiva, and they all started supporting the girl in her diabetes management. Children with type 1 diabetes can grow into healthy adults and can have long fulfilled life. We have so many examples here. For example, we have Usha Diman. She is 68 years old, young, and living with type 1 diabetes from last 63 years. We also have Raju Kekar, who is 66 years old and living with type 1 diabetes from last 61 years. We also have Sri Krishna Swami, who is 86 years old and living with type 1 diabetes from last 70 years. So they are all inspiration to people with type 1 diabetes. Many children with type 1 diabetes grow to their potential and achieve a lot of things in many fields, and they are becoming professionals in every field. We have many doctors, engineers, teachers, scientists, actors, sports professionals with type 1 diabetes. We have good examples here. Nick Jonas. Nick Jonas is a great singer. Wasim Akram, he's an international cricket player, played for Pakistan. Sophie Devine, she's also a cricketer. Drew Weissman, this person is a Nobel laureate in the field of medicine. Adams is a nurse and mountaineer. Thank you everyone for taking your time in learning about type 1 diabetes to help your children with type 1 diabetes. If you have any questions, you can email us. Our email address ideas to empower@gmail.com. We have if you want to know more about type 1 diabetes, you please access the information through our link. Thank you.